My name is Ron Miller. I'm a medical malpractice lawyer at the law firm of Miller & Zois. My law firm handles spinal epidural abscess misdiagnosis cases throughout the country. A spinal epidural abscess is a disorder caused by an infection inside your spine. This infection is caused by bacteria or fungal organism, usually after a surgical procedure. What causes a spinal epidural abscess? The cause can be from a remote source, such as a distant infection, or something closer to the epidural space. Many spinal epidural abscesses are caused by bacterial infections related to the surgery. There are also many abscesses without any identifiable source. It's critically important to diagnose a spinal epidural abscess because of where the infection is located in the body. A spinal epidural abscess is a pocket or a collection of pus that develops in or near the epidural space in the spinal column. The epidural space is located in a critical spot in the human body where the spinal cord controls so many of our bodily functions, such as nerves and muscles. Simply stated, the human body cannot function if an infection is destroying the tissue in this location. In addition, there's always the chance that the infection can spread from the spine to other important bodily organs. Spinal epidural abscesses are almost always manageable when they're caught at an early stage. However, paraplegia, quadriplegia, and even death can result if the diagnosis is not made promptly and treatment is initiated. Doctors, including emergency room doctors, have been trained to rule out a spinal epidural abscess when a patient presents with symptoms that would cause a reasonable doctor to be on alert. Many patients with a spinal epidural abscess complain of back pain, recent infection, numbness, tingling, motor deficits, and sometimes even paralysis. Many patients with a spinal epidural abscess present with a common medical history of recent surgery, an ongoing infection like a staph infection, an infected skin lesion, maybe they have a fever, and bacteria is found in the patient's blood. If the patient has these signs and symptoms, the standard of care requires that the doctor order an MRI. Why? Because they have to locate the source of the infection. As soon as the infection is identified, surgery is usually performed to remove the infection and decompress the spine. In addition, the patient is also given antibiotics. So, like a lot of things, if it's caught early enough, the patient will survive and shouldn't have any paralysis or ongoing problems. Our law firm handles spinal epidural abscess cases. If you or a family member have had a spinal epidural abscess and you believe medical malpractice might have been a contributing cause, again, my name is Ron Miller. Call me today. I'm at 800-553-8082. Let's talk about your options and whether you can pursue a potential medical malpractice claim. Thank you.